Since times immemorial, since the ancient times, in sculptures and paintings, we have seen that one organ in the human body has defined beauty like no else, and that is the breast. I'm Dr. Srinjay Saha. I'm a plastic surgeon and a clinical associate professor at Apollo Hospitals, Kolkata. It is what defines humanness, I would say, in every art form. And we completely understand when women come in talking about what makes them, stand out of the crowd, what makes them not feel comfortable, what makes them, others take pot shots at them, and that is not having enough definition and shape into these organs. We do plastic surgeries in order to get that into a nice, ideal aesthetic shape, and I'm here to talk about that. How can we improve the contour of the breasts and improve it into a perfect aesthetic ideal? We can do it in different ways, by putting in implants or with fat grafts. In fat grafts, we take fat from other areas of the body and then we inject it little by little, 1 milliliter at a time, until it completely gets inside the body in such a way that it stays there. Unfortunately, we cannot do a large volume of fat grafting, but if there's one surgery in which we do just a single surgery and it gives an immediate result, it's an implant insertion either underneath the breast or underneath the muscles. So a breast implant is not where we put it inside the breast, we put it underneath, where the breast ends and the muscle begins. That is a layer where we put in the breast implant, which now forms the new breast mound on which the tissues would drape itself and form a new kind of a shape and give a definition, projection, and an ideal look that somebody can just go out and be proud of their bodies afterwards. So we do it in two cases: in ladies, young ladies who do not have enough breast tissues, and in mothers who after their pregnancies have a very droopy breast, and in those sagging breasts we do a small cut and we lift up those breast volume and try to get that skin into a shape where it forms a perfect mound. In some ladies who have a very tight skin over the chest, we may have to do it in stages, by first expanding the tissues and then putting in a breast implant. This is also true for the survivors of breast cancer, in which case we increase the remaining chest tissues that is there through a tissue expander, and once the chest has expanded well, we put in a soft gel-like implant which feels, moves, and behaves like almost as possible as a natural breast tissues. It's a wonderful surgery, and I can remember plenty of patients who have been thankful. Hundreds and hundreds of patients who has undergone this are so thankful because they got the desired body shape that they wanted, and it has worked wonders as far as their confidence is concerned, as far as their own personality is concerned. It's a surgery that can work wonders.